Oh, wow. All right, it says that it's being live streamed. Okay. Hey, Demia, how are you?
Hello, I'm good. How are you?
I'm good. I'm excited to do this. So everyone who will be joining us, who might catch the replay, who might just be able to pop on for a second, thank you for joining us. As you know, I'm Cherrell, and that's how you say my name, Cherrell. And I'm here with Demia Tyler from Healthy Starts. Healthy Starts has been involved in lots of things. Most recently, we celebrated Black Breastfeeding Week here in Allegheny County. We had a wonderful resource fair in the Healthy Start parking lot, and we were able to touch a lot of families, share lots of resources about Healthy Start and other organizations around the city that are beneficial to moms, dads, other caregivers, babies, the whole family. So what Healthy Start has initiated is a virtual cafe, like a virtual campaign to let everyone know about the services that they offer within their organization that are beneficial to not just moms, because I'm sure a lot of people think of moms and babies whenever they think a Healthy Start, but Healthy Start has programs that are beneficial to the whole family. Healthy Start supports women, children, fathers, families, and communities through comprehensive community-based programming, systems coordination, advocacy, research, and training. The programming spans Allegheny County and Westmoreland County. The mission of Healthy Start is to improve maternal and child health and to reduce poor birth outcomes and infant mortality in Allegheny County. They use a multidisciplinary team model, which is inclusive of community health workers, certified lactation consultants and counselors, because there is a difference, Lamaze certified childbirth educators, certified doulas, nurses, licensed mental health professionals, researchers, community health advocates, and other public health practitioners who touch the entire community. Like I said, Healthy Start is not just an organization that touches moms or touches babies, it touches the entire community. With that being said, I want to introduce Demia Tyler. Demia is the Director of Strategic Initiatives at Healthy Start, and her work has been centered in maternal and child health issues with an emphasis on eliminating disparities burdening the Black community. Demia earned her MPH at the University of Pittsburgh Graduate School of Public Health, Behavioral and Community Health Sciences. While there, she conducted research into doula services and intervention to address the gap in infant mortality between Blacks and whites in Allegheny County. As many of you know, there was a report published in 2019 that talked about so many disparities affecting not just Black women in Allegheny County, but Black folks in general in Allegheny County. But some of the things that were highlighted were the infant and maternal mortality rates for Black women and Black children within that report. At Healthy Start, Demia directs the birth doula program and the postpartum doula program, as well as the Center for Urban Breastfeeding, which I am a COC for. And among other things, she participates in planning and hosting events aimed at bringing awareness to and reducing disparities in birth outcomes, such as Black Maternal Health Week and the Healthy Start Annual Symposium. Demia is also a certified lactation counselor and a DONA certified doula, as well as a Lamaze certified childbirth educator. So Demia, can you tell us a little bit about the doula program at Healthy Start?
Yes. So the doula program, I always say it's my baby. And so the doula program was actually created as a response to the COVID pandemic. We started out as the virtual doula program, and it was really meant to fill the gap that was created as hospitals enacted their social distancing measures and limited the number of support people who could be in the hospital to support birthing people. That left a lot of families like, oh, nah, I'm going to just birth at home. And I mean, we respect everyone's decision around their birth, but we also recognize that home birth requires significant planning, understanding. It requires a team. But this isn't what folks were talking about. They were just like, if I have to birth in a hospital without the people I think need to support me, I'd rather just stay home. Like, I'm just not even going to go to the hospital. And that can be really dangerous without the appropriate preparation. So some of the local stakeholders were meeting to try to figure out, like, what can we do to support families during this trying time? And that was where the idea of the doula program came from. As I mentioned, we started out as the virtual doula program where we use virtual technology. We use iPads and hotspots to connect with our clients during birth. And if there was no other support person, then the doula could support in person, but usually there's at least one other support person. So we were primarily supporting virtually. Well, the demand was more than what I guess it originally anticipated. So as hospitals loosened their restrictions, we moved into the hospitals and we're still supporting folks. We launched on April 27th, 2020. So it's been a little over a year now. The demand is steady growing, and so we're working to grow the program. But that's the doula program in a nutshell.
Wow. I like the fact that the response of Healthy Start was almost immediate. After we found out that there was going to be, major shutdowns. It's like, that was like March 13th. And, like 6 weeks later, y'all had a plan and y'all had it on the ground up and running to say, okay, we're not letting any person birth alone. We're not letting them birth uneducated. We're not letting them birth unprepared. So I really think that that is something that needs to kind of be highlighted a little bit more, that Healthy Start was kind of on the ground running, even though we weren't sure what was going to happen during this pandemic. So would you be able to tell everyone, like, what goes into having a doula through Healthy Start? Like, what do they receive? What does that look like for them?
Yes. So our program is structured. So the program is structured so that you get a welcome visit, which is a time to connect with your doula, kind of get to know the doula, sort of like a get to know you session, essentially. The doula will try to understand whether or not you already have a birth plan, who are the members of your family that will be involved in this process. It's less technical than a prenatal session, but you do get 2 prenatal sessions. And that's where the doulas would provide more comprehensive childbirth education and preparation for your birth. We don't follow any particular childbirth education model. It's just like the typical education that you would get with a doula. In between that, there's also bi-weekly check-ins because, 2 visits really doesn't sound like a lot because it's not. The 2 visits are just meant to really provide a lot of education. And then in between there, your doula checks in with you at least every other week to see how your pregnancy is progressing, check to see if you have any needs. Then, of course, there is the labor and birth support. That's the biggie. And then after the labor and birth support, there's a postpartum visit. And that postpartum visit, we administer to Edinburgh. We again check to see if there's any unmet needs, if there's any additional supports we can connect folks to before we close out the file. So that's really the service offerings in a nutshell. The cool thing is that the birth support can again either be in person or it can be virtual. So some people, for whatever reason, may not want an in-person birth support, and that's fine. You do not have to have an in-person doula at this time. You can still have a virtual doula. What we do is 2 weeks before your due date, we deliver an iPad and a hotspot to our families, and then they would connect with their doula in that way. So you still have the option of virtual or in-person birth support.
That's good. You know, that's just also like, it just goes back to empowering families, you know, with making their own decisions for what they want for their birth. So that's excellent. But there is a postpartum doula program, right?
Yes.
Because that's kind of like, people don't even know, okay, like postpartum, you know, what do I need a doula for after? I thought doulas were just for, you know, labor and delivery. So what, can you tell us a little bit about the postpartum doula program?
Yes, absolutely. So the cool thing about the postpartum doula program is it actually existed before our birth doula program. So we've had the postpartum doula program, I think, since early to mid 2019. And what happened was, within the postpartum doula program, we were going into the homes on like housekeeping, some like childcare support, like so while the parent is present, and then just general like emotional support, education. So we were in the home. So obviously when a pandemic started, we could no longer do that. So we had to temporarily suspend it. And then that was when we launched the birth doula program. So throughout that time, I had been working with some of our doulas to try to figure out how do we reinvent the postpartum doula program and continue to provide support throughout the pandemic, but still, you know, be safe. So that we were able to restructure and relaunch the postpartum doula program. And essentially, to your original question, a postpartum doula program is, a postpartum doula is a doula who supports a family in that immediate period after they give birth. So that can be a period that's filled with a lot of transitions. You have a new family member, a completely new routine. Sometimes it can be challenging to get all of the things done that you were able to get done before you had a new baby in the home. And then there's the emotional adjustment. And so the postpartum doulas help with all of that. Also helping families to recognize warning signs postpartum. You talked earlier about the gender equity report that really highlighted some of the disparities in maternal and child outcomes locally. And maternal mortality and morbidity is one of those outcomes. So we want to make sure that we're arming our participants with the education of what to expect postpartum for the healing and recovery process, and what's a warning sign that, okay, if this happens, I need to either reach out to my provider or I need to go straight to the hospital. So we provide that education as well. This pandemic, like I mentioned, we can no longer go into the home. So we kind of split the doula program. So we provide 2 visits a week, or up to 2 visits a week. One is a virtual visit where we're providing education, we're providing emotional support. We might be connecting to resources. We might be doing some screenings because, as I mentioned, we do the Edinburgh screen to make sure that our moms are recovering emotionally. And then there's a second support. We do grocery pickup, pharmacy pickup. We can pick up your Domino's from down the street and drop it off contactless. So it's an additional support to get some of those errands done that can be challenging to do in that immediate postpartum. And we just, now it's contactless and it's part of the postpartum doula program.
You know, I love the idea of a postpartum doula because I know a lot of sisters who say stuff like, it's like 2 weeks after they deliver and they're like, yeah, I'm ready to go back to work. Like, pump your brakes, calm down. You know, your uterus is still shrinking. Things are still going back to normal. You need to be laying down. So people need postpartum doulas. And if, you know, and if they at least like are like, okay, I don't need you to come to my house, they still need that. Some people. still need that education on why it's important for birthing people to rest, why it's important for them to spend a lot of time bonding with their baby. And do the postpartum doulas provide any type of general lactation support for?
Yes. Yes, that's also another role of a postpartum doula. Generally, they have doulas and postpartum doulas generally have some level of breastfeeding education, some level of breastfeeding education. And so both our doulas and our postpartum doulas do provide general lactation support where needed. And then we'll talk about this in one of the later sessions, but we connect to resources such as our Healthy Start Center for Urban Breastfeeding for more increased support.
When I had my children, I was really young when I had my son in my early 20s, but he was in the NICU for a couple months. So that postpartum period, I had no recollection of, maybe you shouldn't be at the hospital for 10 hours a day. Maybe you should go home and go to sleep because there's really nothing you could do for your baby. And then when I had my daughter, she had a small NICU stay, but she came home a lot sooner. But oh my goodness, I didn't have a postpartum doula, but my mom came and washed clothes. My sister came and cooked food. I had a girlfriend who came and mopped my floors and ran the sweeper. It's like stuff like that. You just don't know how valuable it is until you're looking back on your birthing journey and your postpartum journey, and you're like, man, I was tired. It would have been nice to have somebody to just come and take the trash out. My husband's at work, my partner's at work, or whatever. The kids is at school. It's just me and this baby. So, people really have to get some more information on postpartum doulas and the benefits that they have, not just for mom and baby, but for the whole family. Maybe postpartum doulas could kind of pick up the slack over here while mom and her partner can spend a little bit more time with the baby.
Exactly. Mom, let your postpartum doula pick up those groceries. You just order them on your phone. Your postpartum doula will pick them up and bring them to your house. Just relax.
And you'll be able to look at your fruit and make sure that they ain't just throw any old fruit in the bag, because sometimes you order online, they send you anything.
They do.
Yeah, they do. So I wanted to ask, how many births have you all had so far?
Ooh, a lot. I didn't even think to bring the total number. So yeah, we've had a lot. At the end of by the end of 2020, we had 77 folks had enrolled and 30. We had attended 32 births. So I'll have to check the numbers to see where we're at now, but a lot.
I'm sure that's probably like quadrupled or something by now, because that's like it's almost a whole year later from the end of 2020. So I'm sure y'all been touching a lot of families. So Demia, why do you think it's important and I know you said a few things about why it's important, such as warning signs or just having knowledge about birthing and things like that. But why do you personally think it's important for families to have a doula?
Yeah, so it's funny. I often hear people will be like, oh, you're a doula, so when you have a baby, you won't even need a doula. And that's so not true. Like, it literally doesn't matter what your support system is, how much education and knowledge you have about it. Birthing is such a unique experience, and to have somebody that's there to support you, to support your vision for your birth, to really center you during your birth experience, to make sure that you have the education that you need and the information that you need to make informed decisions is so invaluable. One of the benefits that I really, there are lots of benefits to doulas. Research really shows that, doula support can have an impact, a reduction in C-sections, and, but that's really not, I try not to tout doulas as a magic wand to those medical interventions, because that's medical and doulas aren't a medical intervention. What I really love about doulas and what we've seen since the launch of our doula program is the increase in satisfaction around the birth experience. Like literally, we administer these surveys postpartum, and families are very, and families are like, having a doula, it definitely positively impacted my satisfaction. And so that's really the biggest thing, is just you have somebody there to advocate for you throughout your entire birth, to make sure that, you know, if the doctors are over here saying something and you're in pain, you're in the middle of a contraction, that it's explained to you that, remember that question that you had? Did you want to ask your doctor? Just somebody there beside you to like encourage you and push you throughout birth, because birth is it can be such a rewarding experience when you have the right people in the room who really care about your birth outcomes and making sure that you're satisfied with your birthing experience.
I like to tell people, you know, well, first of all, for those who don't know, a doula is a labor support person. We're not midwives. We do not do any type of medical nothing. We're there to help you breathe, help your partner breathe, or your mom, stop her from cussing the doctor out, or, you know, whatever. Like, we're there to support on an emotional, even spiritual, and physical basis, not a medical basis. So I know a lot of people would come to me and some other doulas wanting to birth at home with no support, but doulas do not provide any type of medical intervention. So if you were birthing at home with just a doula and maybe the cord was wrapped around your baby's neck, or anything, doulas are not trained to provide any type of support in those matters. So that would kind of be all on the birthing person and their support people outside of the doula. So I always tell people, you know, when you're birthing, having a doula is kind of like having an extra person who, if something was to go wrong with mom or the baby, someone can go with the baby, someone can stay with the birthing person, because just because that's your baby doesn't mean that you're automatically going to go right down to the NICU with your baby. It's going to take a couple hours before you get to see the baby, but maybe you have a support person who can go to the NICU if baby was to get sick, and someone who can stay with you. So one thing that I wanted to ask before we end our live is, how do people register with Healthy Start to receive either a birth or a postpartum doula?
Yes, so if you, the easiest way is to visit the Healthy Start website. It's healthystartpittsburgh.org. And there we have an enroll. The doula page has a button where you can click to enroll. It's actually the same button that you use to enroll in any of our programs. So if you're on the website and you're like, oh, actually, I also want to enroll in the Center for Urban Breastfeeding. Oh, and I want home visiting. You can click all of those things all at once. So that's the easiest way to enroll. That information comes right to the doula team. Someone will reach out and complete your intake. Cheyenne Campbell is our maternal or intake person for the doula program. So she'll contact you, complete your intake, and then we'll work on getting you assigned to a doula. That's the easiest way.
Okay. And you know, I just want to say that I tell sisters all the time that Black women need to be cared for by Black women. So you know, Healthy Start is an organization who serves the Black community. And how much is the doula program?
So the doula program is no cost to our participants. And Cherrell, I'm really happy that you mentioned that, because one of the things when we launched the doula program, we knew that the pandemic was going to disproportionately impact Black women, which unfortunately it has. And then we also knew the numbers around the disparities in maternal and child health outcomes for Black women, both nationally and locally. So we really have an emphasis on Black women within the program. You don't have to be Black to be in the program, but at least 75% of our spaces have to be held by Black women. So we were intentional about making sure that we're supporting the individuals who are most in need. And so I'm happy that you mentioned that. And then all of our doulas are Black women. the cool thing is that one goal of the doula program was to provide the birth support to individuals in need, but another goal of the doula program was to connect birth workers in Pittsburgh who would otherwise be out of work because the pandemic wasn't letting doulas in a hospital, to those families. So rather than reinventing the wheel and training all of our staff as doulas, we contracted with local Black doulas to provide this birth support. So we worked with and are working with Ngazi Tibbs, Ayanna Bridges, Jaria Coffey, Serena Stevens-Stewart, Kiasha Edwell, Shamir Moore, Shamaria Sherman. So we're working with local women, independent contractors to provide these services, so that we're also supporting Black women to support Black women. So
absolutely, because we need all the support we could get. So Demia, is there any final things you might want to tell everyone? Any important takeaways that people can, or one tidbit of information that someone could remember quickly to share with someone else that might be in need of the program?
Yes. I guess just visit our website, click the enrollment button for the doula program. That's really it.
I put the website in the comments, so anybody watching this now or later can just go ahead and click that. And the website is really easy to navigate. You will go to, is it community programs or our programs, that tab? What is the tab?
It's community programs, I believe.
Oh yeah, so go to community programs, and there'll be a drop-down menu, and just click doula programs, and you'll be able to complete the information to enroll into the program. I mean, there's nothing wrong with having an extra set of hands when you're in labor, because just because you might have 4 or 5 kids already, you don't know what the next birth is going to be like. It might be completely different from all of the other ones. Pregnancy is one of those things where it's kind of like a mystery. You could get an ultrasound, you could get maybe another scan or something. They still don't know everything that's going on inside of you. So in order to make sure that you have the best support possible, get a doula. Maybe they don't have to be there in the room with you, but that extra support and that knowledge is priceless.
So I want to say 2 things. So I know I mentioned earlier that, I didn't want to tout doulas as a magic wand that decrease those medical interventions, but since we launched the program, we have been able to see how doulas impact those interventions. So one of our very first births, actually, it was our very first birth. We had Brandy Gentry with us at the time. She supported a family virtually. She admits that she was really nervous going into it because it was her first time supporting a family virtually. And first of all, the participant was scheduled for an induction. She really didn't want to be induced. That was not her preference. She was scheduled for an induction. So Brandy reminded her, you have some say so into your induction date. So that, I think they pushed it back from what it originally was. She ends up going into labor on her own. So during the labor, she, at some point in time, she stopped progressing. And so, you stop progressing, they're ready to have you sign the C-section paper. So she stops progressing, they start talking about C-section. Again, Brandy's virtual. She reminds her, you don't have to get the C-section right away. You can ask them, what happens if I wait? And so she did. And they're like, okay, we'll give you an hour. We'll see if you progress. And then we'll need to start preparing, pre-op. So she's like, okay. And that time, Brandy has her moving positions and, just rearranging so that she can try to progress. And then also there's that added stress, weight off of her shoulder. In that hour, not only did she progress, but she ended up delivering. So she had the baby didn't have to get induced, didn't have to have a C-section. And literally all her doula said was, wait, so just have additional encouragement and that reminder, that support for your birth vision was so powerful in that moment. That's one thing. So although we shouldn't be a magic wand because we're not clinicians, doulas do make such an impact.
Absolutely.
And then second, I just want to talk about the other virtual cafes. So this virtual cafe series this month is Infant Mortality Awareness Month. As Cherrell mentioned earlier, infant mortality is Healthy Start's mission. We want to reduce infant mortality and poor birth outcomes and improve maternal and child health. And so this virtual cafe series is meant to highlight Healthy Start's efforts to do that. And so this week is the doula program, but throughout the month, we'll also be talking about our Healthy Start Center for Urban Breastfeeding. As you mentioned, we don't just service moms, so we'll be talking about our fatherhood program. We'll be talking about our home visiting program, and then also our Moving Beyond Depression program. So I just want folks to stay tuned, follow Healthy Start. You can follow our Facebook page and our Instagram page so that you can be alerted of the upcoming virtual cafe sessions, and you can find out about all of the wonderful services that Healthy Start has to combat infant and maternal mortality and improve maternal and child health in Pittsburgh, Allegheny County, and Westmoreland County.
Absolutely. I'm so glad that we got to do this. Everybody who's watching, share this video, share it in a group over there, email it to somebody if you can, have them come over and watch it. I don't know, but if you know there's people out there who will be birthing, who are planning to get pregnant, let them know about the doula program, because there's nothing wrong with having an extra set of hands and an extra set of eyes and an extra set of ears to help you have the birth experience that you want and to possibly prevent any type of negative outcomes that could affect you otherwise. So Demia, I want to say thank you. If there's any other information that you would like me to share out for everyone, please let me know. I will be sharing this video in a couple of my groups to make sure that we're touching as many families as we can.
Thank you.
Thank you so much, Demia. I will be talking to you soon.
Talk to you soon.
All right, bye, everybody.